to be doing the integumentary system. The major functions of the skin is to keep the body in homeostasis. It provides a barrier to protect the skin to protect the body from mechanical, chemical, thermal, and UV light injury, penetration by microorganisms, and loss of water and electrolytes to prevent dehydration. It regulates our body temperature. It synthesizes vitamin D. And it has your touch, pain, temperature, and pressure sensation. It provides nonverbal communication with facial expressions, blushing, and posture. It provides identity through skin color and facial features. It allows wound repair, and it allows excretion of waste such as electrolytes, uric acid, minerals, and sugar. The appendages of the skin includes the hair and nails, sebaceous and sweat glands. This system, as with all body systems, undergoes many changes during aging. The skin contains 3 layers. The epidermis is the layer that we see. The dermis is next, and it gives nutrition to the epidermis. And it contains connective tissue, sebaceous and sweat glands, and hair follicles. The dermis merges below with the subcutaneous layer, or adipose layer, which is fat. The hair, there are 2 types of adult hair. The vellus hair is not as noticeable as the terminal hair. And terminal hair is what we see on your head, your eyebrows. Nails protect the tips of the fingers and toes. The pink that we see in the nail palette, right here, is this is the nail plate, and it's from the pink color comes from the vascular plate that it's attached to. And the white moon that you see right here is called the lunella, and the white free edge is the nail plate past the nail bed. As we can see, Carla doesn't bite her nails. Whoops, got me on that one. The cuticle acts as a seal between the fold and the plate to keep out moisture. Fingernails grow at approximately 1/10 of a millimeter a day, and your toenails grow a little bit slower than that. The sebaceous glands produce sebum through the hair follicles to lubricate hair and skin and reduce water loss. They are present on all skin surfaces except the palms and the soles. Sweat glands include the eccrine, which open directly onto the skin surface, and it produces sweat to control our body temperature. The apocrine is found in the axillary and genital areas, and it opens into the hair follicles and produces it during stress times. It produces that adult body odor that we smell. Now I'm going to begin the history related to the integumentary system. We're going to identify diseases of the skin, systemic diseases that have skin manifestations, physical abuse, risk for pressure ulcer formation, risk for skin cancer, and the need for health promotion and education regarding the skin. We're looking for rashes, non-healing lesions, moles, lesions, bruising, and hair loss. First, we'll begin the health history. What brings you here? Okay, well, have you noticed any changes in your skin, such as rash, moles, lesions that you are, not healing? Nope. Moles that might have changed colors? Okay. Lumps? Nope. Itching? Nope. Do you always bite your cuticles?
Yep.
Do you know that lets in bacteria?
Probably.
Okay. Even some subtle changes in moles. Have you noticed any of those?
Nope.
Okay. Well, I'm going to ask you some questions about your past history. Do you have any skin diseases such as a melanoma, eczema, psoriasis?
No.
Do you have any diabetes or peripheral vascular diseases?
No.
Do you smoke?
Yes.
You know that it affects your fingertips. Have you noticed any changes in your fingertips, the sensations or anything like that?
No.
Okay. Do you have any allergies or food sensitivities?
I have allergies.
What are you allergic to?
seasonal allergies.
Seasonal allergies.
Mold.
Does it cause you to break out in hives or anything like that?
Sometimes.
Where's
Makes
these
my-
hives located?
Mostly my neck and my face.
Okay. Do they itch?
Yeah.
They do? Okay. Do you take anything for this? Have you ever seen a doctor?
Nope.
Have you ever had a severe sunburn
Yes.
recently?
Yes.
You do know, did you have sunscreen on?
No.
You do know that it is very important that you wear sunscreen when you're out in the sun, especially with your light complexion.
Yeah, well, my mom set me up for the fail on that one.
Well, how many second degree burns have you ever experienced?
3.
3 in your life?
I mean, major ones, big ones.
Okay. Have you ever been on a corticosteroid medication for more than 2 weeks? What prescribed or over-the-counter medications do you take?
None.
What immunizations have you had?
Just all my up-to-date immunizations from childhood and stuff.
Did you HPV?
I took the first shot of the set of 3. I never did
Never
get
finished the
those.
series. You know how important the immunizations are.
Yep.
Do you take a yearly flu shot?
No.
Have you ever had a pneumonia vaccine?
No. Never had pneumonia either.
Do any family members have any of the same or similar symptoms? Like, do they burn easy? Have they had eczema or psoriasis that you know of? Any melanomas?
I think my mother.
Has anyone in your family had, I already said that, never mind. Or do you know of any of them having skin biopsies done?
Yes, my mother.
Were they benign?
I think so, yes.
Did it grow back?
Yes.
She have it seen about again?
Probably not.
Does anyone in your family have allergies?
Not that I know of.
Now, describe your bathing and shampooing routines.
Shower, shave,
Do you routinely use the same shampoo and soap?
pretty much, yeah.
Have you ever had any allergic reactions?
No.
Okay. Have you changed product brands recently?
Yeah, a few months ago.
So you don't ever remember it breaking out anything that you use? No allergies to your soap. What about to the detergent, your clothes, that you wash your clothes in?
No.
Do you wear false nails?
No.
Wigs?
No. There was at one time.
Do you go to a nail salon?
No.
A gym?
No.
How much sun exposure do you get daily?
At least a couple hours worth.
Do you wear
Every day.
sunscreen?
No.
Ever?
Sometimes.
Okay. What SPF is it?
Not a clue.
Is it the kind your mother buys?
Yeah.
It's 30. Do you perform skin self-examinations? Do you look over your body for moles or lesions or
Yeah.
lumps?
Yes, I do.
Do you pick at them?
Yep.
How often do you check yourself? You know, your moles and stuff. We all look at our moles.
When I'm in the shower, when I'm just exposed to them.
Okay. All right. Are you exposed to any chemicals or radiation at home or at work?
No.
What are your hobbies?
I like scrapbooking.
Do you get the glue on your skin and you notice a reaction from ever?
Nope.
Describe a typical day's diet.
Either oatmeal or cereal for breakfast, and sandwich and chips for lunch, and some kind of dinner, grilled chicken or whatever.
All right. Now, I'm going to begin my examination of your skin. I'll only expose the parts that I need to see. First, we'll look at your hair, because that is an appendage of the skin. Can you take this off, please? And this. Thank you. Here's that. I need to feel your hair. Check for it. All right. See, your hair, it is thick. It is light brown.